Hello there. I hope you are all doing good today. My name is Eunice. I am a life coach from Eureka Global Coaching. I'm also a mental health advocate with certification in suicide prevention. Today I'm talking about factors contributing to mental health illness. When it comes to factors contributing to mental health illness, we have nature, transitions, life events, and some side effects of some prescribed medication. When it comes to nature, we are talking about family history of mental health problems. There are people who are in families which have history of mental health illness. Such people are prone to experiencing some form of mental health illness in their lifetime. There are also the biological factors. Some people have the illness in their gene or their brain chemistry is wired that way. Example is someone with personality disorder. People with personality disorder are born that way. But the good news is now there are effective medications available to help control the symptoms of the disease. So there is help out there. If you know somebody going through it, help them, let them contact medical professionals, and they will get the treatments that they need. When it comes to transitions, we are talking about loss of relationships, loss of marriage, loss of a child or a dear one, loss of a job. When people lose their relationship or their marriage, sometimes it impacts on them negatively that they begin to feel sad all the time. And before you know it, that long, prolonged sadness has escalated into depression or anxiety or panic attacks or any form of mental health illness, because they are not able to cope with what is happening around them or what is happening to them. Sometimes to a loss of child, sudden death of a child or sudden death of a loved one can trigger mental health issues in some individuals. A loss of job or unemployment. When people lose their source of income, sometimes it can impact on them negatively that it can spiral down into depression, anxiety, or other forms of mental health illness. Lack of sexual intimacy can also trigger mental health issues in some individuals. This is because sex releases endorphins in the brain. Endorphins are the feel-good factors that help us to feel good in our body and also to feel worthy. And when people are sexually active, but it gets to a point that they are denied of sex for some time, it impacts on them negatively, and sometimes some people are not able to cope. And before you know it, it dwindles, their mood begins to swing, and then they begin to feel sad all the time. And before you know it, they are into depression or some form of mental health illness. There is also life event, everyday life event, traumatic experience. Sometimes when people go through some form of traumatic experience like kidnapping or being neglected by their parents when they are young, or abuse, any form of abuse at all, sexual abuse, verbal abuse, mental abuse, emotional abuse. When they go through some of these things, it can affect them mentally and they can develop mental health issues. When it comes to abuse, verbal abuse, sometimes some children, individuals may decide to go into modeling or into acting, and when they go for auditions, sometimes they can be told that, oh, you are too big for this role or you are too fat for this role. And it impacts on them. Before you know it, they have developed bulimia, eating disorder, just to be slim and to fit in that role. There are some children who have been told or they've been verbally abused or bullied. And before you know it, they begin to have suicidal thoughts. A lot of children in the Western world have developed mental health issues. Some of them have even killed themselves because of bullying or verbal abuse. So abuse can actually trigger mental health illness in some people. Accidents sometimes can trigger mental health issue. Somebody hitting their head against the wall or falling down and hitting their head on the floor can cause a shift in the brain chemistry. And sometimes when there is a shift in the brain chemical, the chemical in the brain becomes imbalanced, and it can affect their mental well-being. Sudden death in the family can also affect some people mentally. Sudden increase in salary. Sometimes sudden increase in salary can affect some people negatively. Sometimes some people will get this increase in salary based on the fact that maybe they've been promoted, and this increase in salary may come with additional responsibilities. And some people are told you have to hit this particular target, you have to hit this particular target, and it becomes too much and too stressful for some people to cope with that increase in salary. And before you know it, they have developed maybe anxiety or depression or some form of mental health illness. Everyday issues like driving through and unmoving traffic can also trigger mental health issues in some people. Some people are able to cope, but some people are not able to cope. Social isolation or loneliness can also trigger mental health issues. There are some people who go on retirement, or maybe they become widows or widowers, and they are not able to cope with being alone. And so that loneliness can trigger mental health illness. There are some people who go through retirement and the loneliness causes them to suffer from psychosis or other mental health issues. Homelessness can also trigger mental health issues. Pandemic. The COVID-19 pandemic triggered mental health issues in some people. There were a lot of people who became depressed during the COVID pandemic, merely because they were not able to cope with the bad news and the sad news that was happening, the news that were being presented all the time. I remember here in UK, medical professionals and some mental health professionals came out to advise people to stay away from the news, because watching the news was causing more harm to individuals than good. So they advise people to stay away from the negative news that was impacting on their mental health negatively. There is also long-term physical health condition. This can also trigger mental health illness. Fear and childlessness can also trigger mental health illness. Sometimes some women, when they are going through childlessness, they try IVF and other means, and when they try it several times and they are not getting any positive result, sometimes it can impact on their emotional well-being, and before you know it, it spirals down into depression. Baby blues and postnatal depression are also something that can trigger depression. So the cause of baby blues and postnatal depression is childbirth. So sometimes childbirth can trigger mental health issues. This is because when people sometimes go through childbirth, normally there are estrogen levels drops. And sometimes when the estrogen level drops, the serotonin that is in estrogen also reduces for some people. And this is what causes people to feel good or people to be a bit happy. So when that serotonin decreases, some people become very sad and very low in their mood. And before you know it, they are experiencing sadness, fatigue, and they are not able to bond with their new baby. And before you know it, it's escalating into postnatal depression. If you have had a child or you know someone who has just had a baby and that person is beginning to feel sad all the time and feeling low in their spirit, encourage them to talk to their midwives. Encourage them to talk to health professionals. They will be able to help them because postnatal depression requires medical treatment. And there is help out there for anybody going through postnatal depression or baby blues. Baby blues doesn't need any medical treatment because it goes away after a period of 2 weeks or 3 weeks. It goes away by itself. But postnatal depression need medical treatment. There is also side effects of some prescribed medication. For example, anti-malaria drug like Larium can cause or can trigger hallucination, and hallucination is a form of mental health illness. I remember some time ago when I was traveling to Ghana, I didn't have my regular anti-malaria drug. So I just went for the Larium. I took the Larium, and when I got to Africa, I started experiencing hallucination. There was a day that I just lie down to sleep. Within 5 minutes, I felt like the whole earth had been divided into two, and there was this big hole that has been created, and all the buildings were entering into that hole. I felt that the building that I was in was tilting into that hole, and I started screaming. I started screaming and shouting, and I started mentioning the name of Jesus. I was staying with a reverend minister at that time, and I believe they heard me, and probably they might think that I was praying. No, I wasn't praying. I was hallucinating. And hallucination is a form of mental health illness. So I just want to entreat all of you, when you are buying any form of medication, even if it's a prescribed medication, check on the box, because Larium, on the box, they've written on it that one of the side effects is basically hallucination. Check on the box to see whether that medication can impact on your mental well-being. If it could cause or trigger some mental health issues, talk to your medical doctor again, and they can give you an alternative medication. Let us help remove the stigma associated with mental health. I hope this information helps. Have a nice day.